Good morning and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's media availability. Joining us today, the Honourable Zach Churchill, Minister of Education and Early Childhood Development, and Dr. Robert Strang, Chief Medical Officer of Health for the province of Nova Scotia. Go ahead, Minister.
Thank you so much, Tina. Nice to be back with you, Doc. Good afternoon, everybody. Appreciate your attendance today. As summer winds down, we know that parents and students and our staff and our education system have a lot of questions, of course, and people are dealing with their own anxieties over the plan to return to school. A few weeks ago, we did share that plan amid the pandemic, and there's no doubt of returning amid a pandemic, and there's no doubt that this year's experience will be different than past years. And everyone is understandably anxious about the unknown that's coming for the fall. And of course, we all understand that. We are all sensitive to those anxieties, and as new information is known, we will adapt the plan that we have in place. That's why today I'm announcing a change with respect to mandatory mask wearing. Students in grades 4 to 11 will now be expected to wear non-medical masks while at school, except when they are sitting at their desks, and only if those desks are 2 meters apart. This change is in line with new federal recommendations around mask wearing and what we know about their effectiveness to prevent the spread of COVID-19. These changes to mask wearing will help to mitigate risk when students, teachers, and staff cannot distance. We know that social distancing is not always physically possible, but schools have been asked to be creative and innovative to maximize opportunities for spacing. Everyone will be doing their best to adapt the space they have to create distance in classrooms. Masks are another layer of prevention, especially when full distancing cannot be achieved. In addition to masks, I want to speak about a few other items that I know have been on the minds of many parents. And let me share some updates on the progress as we prepare for September. A school-by-school ventilation assessment is underway to ensure equipment is operating properly and in good condition, and that windows can be properly opened. Masks and hand sanitizer are starting to arrive at schools, and all students and staff will be welcomed back to school by receiving 2 free cloth masks. Disposable masks will also be available if a student forgets or loses their mask during the school day. Before and after school programs such as Excel will be offered in accordance with public health guidelines. Planning is underway and the program will be communicating with families very soon. Our return to school sports schedule and protocols that follow public health guidelines are in the final stage of development with Sports Nova Scotia and will be communicated to schools by the Nova Scotia School Athletic Federation. Regional Centres for Education and the Conseil Scolaire Acadien Provincial have provided their first update to their communities, and their next one will be out next week. Principals will reach out to families with specific information about their school beginning on August 24th. Helpful resources for families and students are also currently available on our website, and more will be added. As of August 21st, these resources will include videos and pictures of the inside of some of our schools and social stories in French and English to assist parents in helping their children prepare for a different start to the school year and the new habits that we all have to develop. We are also investing an additional $40 million to support students and teachers as they return to school in September. This investment will mean more teachers, more cleaners, and more supplies to students. And that includes $29 million for more substitute teachers, $8.7 million to hire the equivalent of 175 more custodial staff to support enhanced cleaning, $1.4 million to extend the workday of early childhood educators in pre-primary, allowing them to conduct proper cleaning in their classes, $1.2 million to hire more lunch monitors, and $500,000 for school supplies. And that's the regular school supplies, pencils, pens, erasers. We're buying more so that students do not have to share those items. I know many have been concerned about what will happen if a COVID case is found in the school, and there is no one-size-fits-all. And I know that Dr. Strang will speak to that. But communities will be made aware if there is a COVID case very quickly, and along with measures that will be taken at the direction of public health. And of course, those measures are going to be directed by Dr. Strang and his staff. I want to end my remarks by reiterating that we all need to be in this together. We continue to meet several times weekly with our partners, including the Nova Scotia Teachers Union, our Administrators and Principals and Vice Principals Association, Public Health, our early years and pre-primary partners to review our implementation plan and to make necessary adaptations if needed. Along with public health experts, psychologists, psychiatrists, and mental health specialists here and across the country, we do agree that the best place for our kids is in school. We have been very fortunate so far in Nova Scotia with the levels of COVID-19 that we've had, and that means we're doing well, but it takes a village to make this work and to keep COVID off of our doorsteps. It is in this environment that we are taking cautious steps to reopen schools and try to bring some sense of normal back in the lives of our kids. This only works if we stay alert, follow public health directives, and keep our guard up. Please keep wearing your mask and keep a safe distance from one another. We have more than 120,000 students and children in the school system, more than 10,000 teachers and staff, and all of them are counting on us to stay vigilant. We need this to work for all of us, and we can do that by continually working together. Thank you very much.
Go ahead, Dr. Strang.
Thank you, Minister, and good afternoon, everybody. The last briefing that I was with you was on Friday, July 31st. Since then, we've announced 3 new cases of COVID-19. 2 of those were on August 2nd, and both of those cases have since resolved, and the follow-up of those cases has been concluded. Today, we're announcing 1 new case of COVID-19 in the northern zone. This case remains under investigation by public health, and we'll be able to share more information with you when that is available. So to date in Nova Scotia, we've had 1,072 cases of COVID-19. We've had 67,712 people who have been tested with a negative result, and have had 64 deaths. Yesterday, the QE2 Health Sciences Center's microbiology lab completed 582 tests. So overall, our COVID-19 case numbers remain low and infrequent, and it's where we would like them to stay. But we have to remember, since July 1st, we have had 10 new cases. We are announcing a new case today. So it's a reminder that COVID-19 is not gone. That we have to, as in the minister's words, we have to remain vigilant, and that there's that people can't assume that we can relax on the measures that all of us need to be taking. We still have a long way to go in regards to COVID. But we are where we are because people have collectively committed the hard work and following the rules, and we need to continue to do that, because that is what will minimize the risk of COVID-19 in our communities. And one of the ways the most important way we can keep our schools open and keep our schools safe is to have low COVID in our communities. So keeping our schools safe is actually something that's in all of our hands together that we need to work on. So as Minister Churchill said, that it is important that our children are able to be in school, not just for their academic learning, but also for their social and psychological development. That is a consensus amongst public health and amongst the pediatric community, that children need to be able to be in school for their overall health and well-being and development. So we need to balance the safety measures that are necessary for COVID-19 with that need for children to be in school. I recognize that the situation around school may be creating fear and anxiety for parents, students, and teachers. This is actually quite normal. We are in a pandemic. There is a lot of uncertainty, and we did have to have a very strong response to the first wave. So if you're feeling anxious, feeling fearful, the first thing is to remind yourself that that's okay and that's normal. However, COVID-19 is here for a long time, and we need to learn to live our life, balancing COVID safety while allowing, as much as possible, aspects of our daily life, including learning environments, to continue. The school reentry plan provides an appropriate balance of allowing in-class learning while applying the necessary public health measures in a layered and complementary approach. It is also flexible and will adapt if and when our local epidemiology changes. The 100% approach is based on maintaining a low level of COVID-19 activity. And I think that seems to be forgotten by a lot of people, that the current approach that we're opening schools with is based on our current level of epidemiology. And if that epidemiology changes, either in a local area or across the province, the school plan changes, the strength of the public health measures increase. And so we have a flexible, adaptable a plan that allows the appropriate level of safety, finding the balance between COVID safety and allowing learning to happen in the best way possible. The plan will also be flexible as our knowledge evolves. So, for example, since releasing the plan just a few weeks ago, the advice and the evidence has changed on masking. And that's why today the plan has been amended to require masks for students in grades 4 and up, except when students are seated in their classrooms and are facing forward 2 meters apart. If they're able to do that, then they are able to take the masks off in their classroom, only in those circumstances. This change is based on new guidelines released by the Public Health Agency of Canada. They now recommend masks for children ages 10 and up because it's that age group that may be as likely as adults to transmit the virus. Children under the age of 10 are much less likely to transmit COVID-19. And the national recommendation, which is aligned with international recommendations, is because of that much lower risk of transmission, younger children under age 10, we're not saying need to wear a mask in the classroom. They do need to wear a mask on buses and when they're in hallways in schools. So that changing evidence is why it now makes sense to protect our school communities by adding in the requirement for masking in classrooms for grades 4 and up. I fully endorse this policy, and it is consistent with, as I've said, the public health guidance nationally and in other provinces. The minister also noted that the province is supplying masks to schools, which is important. We need to make sure we have access. Anybody who has their own proper non-medical mask, we encourage them to wear it to school if they're on a bus, or bring it to school with them. But every student, teacher, and staff member will be given 2 reusable non-medical masks at the start of the school year. There will also be disposable masks available in schools for various reasons if people do not have a mask. There will be situations where individuals have a valid medical reason for not wearing a mask, and that reason will be respected. We all need to be respectful of people who have situations that do not allow them to wear a mask. So the important thing now to encourage families and parents is to help our children to get comfortable wearing a mask. Don't wait until the day before school to have them to start to learn how to wear a mask. And now they have to wear it in indoor public places. So it's a perfect opportunity to, as a family, get comfortable with having a mask on, learning how to take it on and off properly and safely. I've certainly been encouraged by how quickly Nova Scotians have embraced the masking policy, both on buses and in indoor public places, and I want to thank Nova Scotians for that. It's becoming quite unusual to see somebody without a mask in an indoor public place, and I think is an indication of my belief, as I've said here before, that if we had a mandatory policy, we don't need to have strong enforcement. The majority of people will do what's necessary to keep each other safe, and I want to thank Nova Scotians for that. By doing that, you're helping normalize masks for our younger people and showing as a role model, and it'll help them to adapt to wearing masks in schools. But I want people to understand that this masking policy is just being layered on. It's an addition to the many measures that are already the public health guidance and the other public health measures that are being worked on and implemented as part of the school reopening plan. And we'll continue to work with the Department of Education, the regional centers for education, and individual schools to ensure that we have safe learning environments to welcome teachers and students back to come September. And we'll continue to be at the table working with the education system as the fall evolves, as our epidemiology evolves, and as the evidence evolves around COVID-19 to adjust the plan as necessary and required. As I said earlier, I know that families and staff may be anxious about returning to school. This is normal and expected, but I do want to reassure people that that while COVID-19 may be new, the established public health protocols that we use to respond to communicable diseases are not new. They are the same approaches that we have used for a long period of time and are well versed in public health. Whether it's pertussis or whooping cough, measles, chickenpox, are steps that we take in terms of identifying cases and contacts, taking the necessary protective steps for schools, with our education partners. We have lots of experience with that, and it's how we've also been responding to COVID-19 in other community settings. And so it's, I think I want people to understand that how we'll be approaching COVID-19 in our school setting. Public health is well versed in this and applying a COVID-specific lens to it. We have a lot of experience and expertise in this. If a case is identified in a school, public health, we will act quickly to identify and test anyone who may have come into close contact with that person. That's our normal process. And that's one of the reasons why we're keeping students in their classroom cohorts and limiting contacts between cohorts. So if we do have a case, we have a limited number of people that would be considered in terms of a close contact and require testing, and limit the number of people who may then come down with COVID themselves. If anyone tests positive, they will self-isolate at home for 14 days. People identified as close contacts will also be quarantined for 14 days. And then any additional steps will be guided by public health with the school based on the specific circumstances around that individual case. Communication to parents and families has always been and will remain a priority for the public health response when we have a notifiable disease in a school. So in closing, I just want to come back to remind all of us that the public health measures that we've all been practicing for the last 6 or more months, hand washing, cough etiquette, staying home if you're sick, maintaining physical distance as much as possible, and now more recently masks, are what really matters in keeping COVID out of low in our communities and out of our schools. The most important thing we can all do to keep our schools safe, to allow our children to be in school and our teachers to be in school, is to keep COVID rates low in our communities. And we all have a role in this. Each of us, by doing all the public health measures ourselves, I keep coming back to, it's how do we create a community that's safe for all of us. So everything we choose to do or not do has an impact on ultimately on our ability to keep schools safe. I know that we won't be able to entirely prevent new cases. I fully expect that we will get COVID cases in a school. But that doesn't mean that what we've got in place has not worked. We fully expect that to happen. But our goal is to keep our COVID cases low. And if we follow the practices that worked in the first wave and that have worked in the past to protect our school communities from other communicable diseases, we'll be able to maintain appropriate levels of safety and have our children and teachers in school as much as is possible. Thank you, Minister. Tina.
Again, just a reminder, we'll take one question and one follow-up. We'll start in the room and then we'll go to the phone lines. Sure, go ahead, Minister.
Tina, who's very astute, pointed out that I said 4 to 11 mandatory masks. I did mean for grades 4 to 12. I just wanted to make sure that was clear, and my apologies for misspeaking on that.
All right, we'll start in the room. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Just in terms of the mandatory masks, you said that they would be required unless students are sitting at their desks 2 meters apart. How many classrooms actually have all the desks 2 meters apart?
So I don't have that information for you, but our regional centers of education, our schools know where they're able to do that and where they're not able to do that. We are, the orders have been given to school communities to maximize space in our classrooms by removing unnecessary furniture, clutter, anything that's in the way to maximize space between students.
Go ahead with your follow-up, Alicia.
And in terms of self-isolating, if somebody does test positive, Dr. Strang, you said that close contacts will also be required to self-isolate for 14 days. Is a close contact their full classroom cohort?
That depends on the assessment by public health. So every time we have a case, we go in, but in the school we'll go in and say, where was that child while they were infectious? Who were they? And we have a definition of a close contact. Who would meet that definition? It may well be the whole class, but we're not going to say without that assessment of that it will or will not be the whole class. It's certainly entirely possible. There may also be other parts of the school. But I think people need to understand that assessment is what public health does. We've done with every single COVID-19 case. We do this all the time with a range of notifiable diseases. We understand for each disease the periods of time when that person could have been infectious and able to spread to others. We understand in detail all their activities and what would have put other people at risk, and then we take appropriate measures. It's that same approach around COVID-19 in a school.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thanks. I'd like to hear from both of you on this, if I could. Dr. Strang, you mentioned that the shift down to grade 4 reflects the recommendation now that's countrywide, if not beyond. But the recommendation for being masked, if you're fewer than 2 meters apart, has been in place much longer than that. And I wonder to what degree that change, requiring kids to keep the mask on while they're in class, if they can't be 2 meters apart, actually reflects the public concern that's been voiced since the initial plan came out.
So I'll speak first. I mean, this is based on is not my assessment of evidence. My guidance to government is not based on public concern. It's based on science and evidence, and clearly we have evolving evidence around the value of masks, especially for and that is the value of masks is based on the evolving evidence around of the ability of different age groups of how effective they can transmit the virus. Because we've got to remember the value of a mask is minimizing the chance of me spreading it to you. And a month or 2 months ago, we were at a place where the evidence was saying we're not sure that kids are great transmitters. But now we have newer evidence that says, well, you know what, basically age 10 and up, they basically can transmit it almost as effectively, if not as the same as adults. So that is the science which is driving the value of why we need to add masks on top of all the public health measures, not because of there's a public sentiment one way or another.
I mean, I would agree with that. We know anxiety is running high. A lot of information spreads quickly online. People are looking at stories from the U.S. and other jurisdictions where the situation with COVID-19 is very different than it is right now here in Nova Scotia. And of course that contributes to people's anxiety and concern and uncertainty. But in terms of making decisions in this regard, we're taking our lead from public health. And the best way we can make decisions in the interest of all of us and public safety and health and well-being is by following the science, the evidence, and taking the lead from public health experts who interpret that for us.
Okay. And Minister, on the $40 million, is that new money? And specific to the money that's going to hire more teachers, where are these people coming from? Because my understanding in previous school years is at times there was a shortage even just to get substitutes in. So how are you going to find those people?
So close to 30 million of the 40 million is for additional substitutes. Of course, the rationale for that is if we're getting into cold season and flu season and people are getting sick and aren't coming to school because of the risk that it could be COVID-19, that affects our numbers of staff. So we want to bulk up that substitute list that we have access to, and we're doing that. We have tripartite agreements with the union in various regions on this. We're using those as the basis to go outside of the BED requirement for substitute teachers and bring in other qualified people who might not have a BED, because at the end of the day we do need to have people in school to run our schools, and if we are facing a risk of less people being there because of COVID, because of other symptoms that they have, we need to be prepared to meet that demand in our schools. And this is new money.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. You've said a few times now that the plan can adapt if there are additional COVID cases. I think a lot of parents and teachers want to know what the threshold is to close a family of schools. Is it if you have 10 cases of COVID? Is it if you have one? Are you guys any closer to kind of laying that out so people know when you could trigger a full in-person classroom setting to online learning?
So as I said before, and we never will base our things on a specific number. It will always be based on an assessment of what's happening in the local community, what's happening in the schools, and our assessment of, even with an individual case, we have to look at where is that person likely exposed? Who have they exposed? Who have they then exposed, or how have they exposed other people? So there is no specific number which is a threshold. It's all based on context, and that may sound kind of fuzzy to some people, but that's how we do all our notifiable diseases. It could be that if in a single case we may, because of exposure to others in other schools, it may be we take an approach that's beyond a single school. And also we have to look at what is the epidemiology in the surrounding community at the time. So it by necessity, it has to be contextual. But that's why I want to come back to, this is not new. We're not just making this up with no experience. We do this all the time in public health, applying the context to our understanding of specific cases and figuring how wide and broadly we need to go with the necessary protective measures.
Go ahead, Natasha.
On the new case that was announced today, is there any indication at this point in time that it could be community spread?
It's a single case where public health is doing the follow-up today. I don't have any more details at this point in time.
Next, we'll go to Andrew Rankin from the Chronicle Herald. Go ahead, Andrew.
So Ontario just set aside $500 million to address ventilation class sizes and distant learning. So I'm wondering what this province's plan is to address those obvious concerns amongst parents and students.
I mean, my understanding of the Ontario announcements is that they've tapped into a surplus there at the board level for this. So as I mentioned in my comments, we are doing a full assessment of our ventilation systems right now to make sure that they're operating and that they can operate to full capacity. Some of our older schools may not have a ventilation system, so we're also looking at windows to make sure the windows can open and close and that we have proper ventilation in our classrooms.
Go ahead, Andrew, with your follow-up.
So given that in the fall and winter seasons, a lot of students, particularly younger children, have flu symptoms that mirror COVID symptoms. So I guess what's the plan to deal with that issue, ensuring that the system doesn't get overwhelmed and parents aren't waiting long periods of time to get their children tested?
So we're doing two things. We have a very broad level of symptoms now. We're in the process with my public health team and the medical officers assessing that. What is the appropriate list of symptoms? But we do, it will by, and we're looking at, the cases we've had over the summer and what are the kind of the common presenting symptoms. But at the end of the day, we need to make sure that we're on the alert for the range of symptoms that could be COVID, because the very first and most important step to protect our schools is minimizing the chance of somebody who has symptoms that could be COVID from coming into the school. We are also working, and very, very, very much aware, working with the Nova Scotia Health Authority, that we have a number of priorities around testing. We're working on testing strategies for universities, et cetera. We're aware that there's going to be an increased demand for testing as we open up schools. So we're working with the Health Authority to make sure we have the appropriate capacity for testing and also timely turnaround of those testing results. Fully aware that there were some challenges over the summer, which was we'd reduce some capacity as we tried to shift things for other healthcare services. Summer's always a challenge in the healthcare system because of vacations, et cetera. But make no mistake that we're working with the health authority. We know we have to have an appropriate level of capacity and timeliness of response, and that will be there.
Next, we'll go to Paul Legere, Radio-Canada. Go ahead, Paul.
I was speaking to some teachers who were saying there's 3 weeks approximately before the students return to school, and they're not actually ready or properly trained or properly prepared to greet the students with these new protocols in place. So, what do you say to these teachers who feel they're not ready?
So we have had that information available for weeks now. So we know we're getting close to the school year. We have reached out to every single parent in the province to help them get ready, help them prepare their children and older kids to get ready for school. And the regional centers of education have sent out their initial implementation messages to staff. And principals are coming back a little early to also communicate to school communities. So we do have information available to help people get ready for this. We did announce this, I believe, 3 weeks ago, this plan. And we are communicating proactively with staff, with our parents and school communities. But we do need people to read the information if they have questions. We have that information available on our website. It has been pushed out to our education system, the links to appropriate information. We've had guidelines available on the coronavirus website continuously since this pandemic began. And I believe there's information there if people require it. We have information there to help parents get our kids ready for mask wearing, to talk about proper hand sanitation, why it's important, to acclimatize them to the new habits that we all need to have as we head into the fall. And I trust our administrators, our regions, and our principals to deliver that information to their staff. So I mean, I just keep encouraging people to read the plan and access the information that's available and that has been sent out.
Go ahead, Paul, with your follow-up.
Yeah, I'm just wondering for substitute teachers, will they be moving around from school to school?
So we did deal with this question in our first announcement on the back-to-school plan. We are trying to schedule substitutes in such a way that the amount of schools will be reduced. So obviously, if it's possible to keep a substitute in one school or a family of schools, that's going to happen. So scheduling is a big part of this for substitutes, and also looking at scheduling for students in the older grades to do our best to keep the same group of kids together as much as we can. That's not going to be perfect. We're not going to be able to fully cohort in those older grades, but scheduling can help us reduce the amount of contact between students, and so that work is happening, yes.
Next, we'll go to Lindsay Armstrong from Nova Scotia. Go ahead, Lindsay.
Minister Churchill, with the new funding you announced today, with funding for teachers, which largely just sounds like substitutes, does any of this work towards decreasing class sizes?
So we've previously put a lot of money into class caps here in Nova Scotia. We've got 98% of our classes in the province that are at or lower than the class cap. In the 2% of cases where we are over class cap, it's usually between one and three students. If memory serves me correctly, and maybe 5 in some circumstances. So we are doing well on that front. There's some exceptions in some schools that, particularly here in HRM, of course, that are at or above capacity. But overall, we have put a lot of effort into this. We've hired a lot more teachers over the last number of years to implement that class cap, and we are at 98% of our classes being there. There's also money that in the dollars that I announced of new funding earlier. There's also money there for lunch monitors, and of course custodial staff as well. So yeah, a bulk of it is for substitutes, but there's also money there for additional custodial and lunch monitors too.
Go ahead, Lindsay, with your follow-up.
Thank you. And for Dr. Strang, I understand you've explained that the system to decide if a school will be shut down because of COVID is flexible and deals with the public health sort of epidemiology, and that you're not able to say how many cases would effectively shut down a school. Can you elaborate a bit more about the process to understand how a closure would be called? And is it possible that an entire class or cohort might be moved towards online if there's an outbreak? Is that the sort of system that is possible?
Yeah, and my team is working on as much as we can, anticipating scenarios of a single case in a classroom, a student or a teacher, multiple cases, increase activity in community. So we're working at that right now to get it to the point, knowing that we can't make final decisions until you have an actual case in front of us. So our starting point would be, then that's one of the objectives, if we keep students in classroom cohorts, then the purpose of that is to minimize their ability to be in close contact outside of their classroom cohort. So our starting point is always going to be, we take the individual person and say, who are they in close contact with? And if things have worked well in the school, that it is in all likelihood will be confined to that single classroom. So then we have to say, well, what are we going to do? It could well be that a number of students or all of those students in that classroom have to be then quarantined for 14 days because they're considered close contacts. We'll work with the school system around how do they continue to learn. But then if there's been other exposures in the school, potentially then we'll have to go broader than that. But our starting point is the individual classroom and that classroom cohort. That's the reason we created the cohorts in the first place.
Next, we'll go to Steve Zhao from News 95.7.
Thank you. Minister Churchill, I guess this is for you. With the new change of grade 4 plus masks for students, I'm just curious to what degree or how have you been able to sort of write that into the plans so to ensure that it is enforced and whose responsibility that will be?
So that has been an update that we've made to the plan. So it is in the literature articulating this plan that's available to the public. And like any rule in our school, our administrators, our principals, our VPs, our school staff, our teachers, they play a shared role in enforcing rules and supporting the following of all of our rules in the education system.
Go ahead.
I guess sort of as a related follow-up to that, to what degree have you been in consultation with the teachers union in that with regards to these types of rules and responsibilities being handed off to instructors and teachers?
Thank you. So the teachers union has been at our working table since day one as we built the at-home learning plan last year and as we've built this back-to-school plan. And I mean, that group has been meeting weekly for months, 1 to 3 times a week. And there's numerous representatives from the Nova Scotia Teachers Union that have been a part of this process the entire way, and their feedback has been incredibly valuable. They're bringing that insight from the front lines to that working table, and their input has contributed to a plan that I believe we can have confidence in, and a plan that allows us, as Dr. Strang said, to be responsive to any changes to epidemiology of COVID or new research and information that comes out related to it. So I do want to thank them. And they've been at that table. The IWK has been at that table, of course, public health, and we've also consulted with other public sector unions that represent staff in the education system.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Dr. Strang, I hear from a lot of parents and teachers, and they're generally supportive, although hesitant about the back-to-school plan. But they weigh it against the possibility that we may be opening the Atlantic bubble to the rest of Canada, and they see those two policy decisions as being diametrically opposed, and they're worried because they hear the Premier saying, well, we might go it alone or whatever. Can you address that?
Well, there's lots of conversations happening. You can understand that discussion around the Atlantic bubble has been around for weeks, but it hasn't happened yet. And that's simply, acknowledging that that as we do that, inherently more people movement brings some level of increased risk. But at the same time, that there's some necessities around that. So, as I said at the outset, our overall response to COVID, we have to learn to live with this for months and if not years to come. So it's finding the appropriate balance to allow a whole range of activities to happen as much as possible. So both of these are about balancing, and even if we open up to the rest of Canada, it doesn't necessarily mean that we're going to have a huge surge of COVID-19. Much of that is manageable if we have the ability to detect cases early through testing, rapid public health response, and also if we have everybody adhering to the necessary, personal measures around distancing, masking, etc. Those two kind of streams are how we control things, even if we allow more people to come in from other parts of the country.
Go ahead, Tim, with your follow-up.
Yeah, I was a little confused by something you just said in answer to another question about cohorts. A while back, you gave the example of going to a wedding and we could be with 10 people at a table, but that didn't mean we could get up and go to the next table and be with 10 people. But that's essentially how high school works. You're in a class with 20 or so students, and then you get up and you go to another class with a different 20. But you just said for contact tracing, well, they're in a cohort, so.
We're having cohorts in where we have classrooms. That's the difference between high school and younger grades. In the as much as possible in the grades where they're based on a single classroom, we're going to keep cohort them. Once we get to grades, and correct me if I'm wrong, I think it's grade 9 and up, then they move based on their timetable. It's a different structure. And that, if you remember, when we first announced the plan, we had masking for those groups, those higher grades, in the hallways, but and mandatory, and we weren't as strong on masking for the younger grades. We're now strengthening masking everywhere. But this is about balance, Tim. We need those people to be in school, every grade. And so how do we create, given the environment and how they move around, how do we create as much safety as we can? I fully believe that that's an appropriate level of safety for those in those higher grades. What it does mean is that if we do have a case, that we're probably going to have more contacts, and that's just inherent in the nature of how those classes are run. It doesn't mean they're unsafe. It just may mean that there'll be more people that we have to deal with as identified as close contacts.
And we are trying to tackle that challenge with scheduling to the best of our ability. That is not going to be perfect, but we are going to try to reduce that level of contact between students to the best of our ability. It's all about mitigating the risk. We can't eliminate it, as the doctor said, but we can take these steps to mitigate.
We'll go to the phone lines now. We have a number of reporters on the phone. We will start with Michael McDonald from the Canadian Press. Go ahead, Michael.
Thank you. I have a question for Minister Churchill. We heard yesterday that Ontario is spending millions upgrading ventilation systems. What do you say to Nova Scotia parents who are concerned that Nova Scotia schools won't have proper ventilation in place when school resumes on September 8th?
Okay, thank you for the question. I've addressed this twice in today's press conference. So we are currently doing a full assessment of our ventilation equipment in every single school in the province to make sure that it's functioning and functioning at its highest level. So that is happening right now. If there's any maintenance requirements that we need to be engaged in, we're going to do that. And we're also looking at windows too, because that's another way to ventilate schools. And we do have some older schools in Nova Scotia, so we're making sure that our windows are able to be opened to a satisfactory level in all of our schools as well. So that work is ongoing right now. And of course, if maintenance is required, we already have funding budgeted for that. We do have maintenance funding embedded in our budget, our overall budget, and particularly in the regional centers of education budget. So that's the funding that will be tapped to do any maintenance. And I'm not getting any indications yet that we have any big problems there that would go over those maintenance budgets at this time.
Go ahead, Michael, with your follow-up.
Minister, you mentioned older schools and the fact that some of them don't even have ventilation systems, and you talked about windows, but what happens in the middle of the winter when the temperatures plunge? Are you just going to keep the windows open? What's the solution there?
Well, yeah, I mean, windows can remain open. We have heating systems in all of our schools, and ventilation is important based on the recommendations we're getting from public health. So, I mean, the windows you can open them up a little bit, you can open them up a lot, and I'm sure that level of opening will be adjusted depending on what's coming into those windows, depending on the weather outside. But we just want to make sure that they're working, because that is I believe that's an important part of making sure that our schools are breathing properly.
Next, we'll go to Cody McCackern from CKBW in Bridgewater. Go ahead, Cody.
So my question is more for Minister Churchill. From my understanding of the school plans so far. You had mentioned earlier that we do certainly have some schools that are overpopulated and understaffed. Why wouldn't the province shift towards more of a hybrid plan to offer parents who wanted to keep their children home and learn online in order to sort of reduce the amount of students that are going to these schools that just don't have the staff to keep them educated in a safe manner?
So as I mentioned, for the most part, in 98% of cases in our classrooms, we have schools that are at or below the class caps, and those vary from elementary to high school. In the remaining 2% that might be over class cap, we're looking at numbers from, on average, one to three people, 1 to 3 students over. So this image of, our classrooms busting at the seams, I do not believe to be an accurate one. There's 1 or 2 schools where there is some real space challenges and there's some crowding for sure here in HRM, but generally speaking, that is not the case. So we are hiring additional staff. We are hiring, and we've hired new teachers every single year. And we're hiring more heading into this year. I've announced funding today for additional custodial staff, for substitute teachers, lunch monitors. All of these staff are being hired to deal with some of the operational pressures associated with the new requirements, health and safety requirements in our schools.
Go ahead, Cody, with your follow-up.
Now, you mentioned earlier that the school's staff, the principals and the teachers, they're heavy assets on enforcing rules that go on in school. I'm curious how the province expects teachers and principals to keep a bunch of potentially 10-year-olds in a mask all day if required, and what are the circumstances for those students who simply refuse to wear a mask?
So listen, we are all getting used to this new reality of and necessity of mask wearing. I find it's actually adults that are having the hardest time adapting to this new habit. I myself went through some discomfort when I started wearing a mask and getting to the decision where I knew that I had to do it. I actually think the young folk in our education system will probably be a little better at adapting to this. And Dr. Strang might have some additional thoughts on this, but our kids have to wear a mask now when they go out in public, when they're going to the doctor, when they're going to the dentist, and I think we're getting used to this. And the younger the younger ones among us are probably getting used to it a lot quicker than the rest of us. So we do want to help parents get their children and older kids accustomed to these new habits that we have to develop with mask wearing and hygiene. And so we have resources available online to help parents do that. As Dr. Strang said earlier today, this is the time to prepare as we head into school. Let's not wait till the night before to show our youngsters how to put a mask on or explain why it's important. Let's utilize the resources that we have available for parents. These have been pushed out to everybody in our school system, and we've reached out directly to every parent whose contact information that we have. And I really encourage people to utilize those resources because it's going to be on all of us to follow these guidelines and do our best as we head into the fall. And I do want to talk about our teachers and our principals and vice principals. These folks have really stepped up to the plate. Over the last number of months when we all had to figure out how to learn from home, I saw stories and examples across our province of teachers being innovative, creative, even driving around in some cases with nice signs to let their kids know they were thinking of them. So, these people in the education system are service people first and foremost. They're in it because they care about kids and their well-being. And they have my full trust and confidence in continuing to do their job and stepping up to the plate and doing their part to help teach our kids why this stuff's important. And, of course, as they do with any and every single rule in our school, do their best to help ensure that people are following those rules.
Next, we'll go to Ed Halverson from QCCR Radio in Liverpool. Go ahead, Ed.
Yes. My question is for Dr. Strang. will students or parents have to explain the medical reasons to be exempt from wearing a mask in school?
No, we're not asking that, the people have to have a medical certificate. We're taking, people say I have a medical reason. We accept that. We also understand in the schools there's another layer where kids with ongoing, chronic health complex and chronic health conditions are already well known in many circumstances in the school system, because there's a number of other things that have to be adapted for them. So many of these will be known for other reasons to the school system. But as I said earlier, I think the vast majority of people can wear a mask, wear it safely. I don't see any reason why we're going to have anything different in schools than what we're seeing now in the last couple of weeks. That the vast majority of people who can wear a mask are wearing a mask, and people are stepping up. And I see the same in schools.
Go ahead with your follow-up, Ed.
My follow-up is for Minister Churchill. Who are these substitutes without BEDs that you're going to get into the system? What qualifications will they need, and does the NSTU need to sign off on their hiring?
So we do have tripartite agreements between the department, regions, and regional unions for the most part to do this. I'm not sure exactly who the people are. I'm not involved in the hiring of these folks, but there's people with skill sets in various courses that would be our first choice. Obviously, if someone has experience in music or phys ed or has a degree in history or English. These are obviously the first choices for non-BED holders to come in. Some folks that do have some subject matter experience or expertise. And I mean, if you do have any kind of specific questions on how those hirings happen or what criteria is used, I'm probably not the best person to ask for that, but we can get you in touch with the regional folks or get an HR person from the department to follow up with you, Ed, if that answer is not satisfactory to you.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thanks. I'd like to talk about sports for a sec. Provincial sports organizations were told this week that the limit of 10 people in close contact is not changing. It's not being raised, which might allow more sports. But why are we allowed to have groups of something like 30 students and teachers in a classroom all day, but we can't have 22 players and a couple referees on a soccer field for one game?
So this is all, I had lots of conversation with the sports folks and my public health colleagues this week on this issue. This is all about what are our priorities. And I have to say, we have lots of opportunities, even if it's not full competition for all team sports. There are lots of ways around, small group skill development, et cetera, which is giving lots of opportunities for kids to be out, to be active, to be involved in building skills in a certain sport. We also give them opportunities in kind of theater and music, et cetera, as well. And so they have those opportunities. But our first priority is getting our schools open and keeping our communities safe so we can keep our schools open. And again, it's the balance. So we have to, to do that, we have to facilitate and allow larger groups in a learning environment with appropriate levels of safety. One of the key reasons why we said we're not going to increase the numbers that are allowed for sports, because that itself introduces another risk for community transmission. It puts potentially the kids who are in school into another setting where they can be at increased risk for transmission. And so the consensus was that it's not that we may not do it sometime down the road, but our priority needs to be opening schools up, creating conditions in communities which allow schools to remain open. So what we've done essentially is we put a higher priority on kids learning than having full competitive sports, knowing that kids and adults still have lots of opportunities to be active in sports in different ways.
Go ahead with your follow-up.
Okay. Can you clarify exactly what changed about masks in schools or around that policy today? Because when this was first announced a couple weeks ago, high school students did have to wear masks. So I'm just not seeing exactly the way the masking requirement has changed.
masks in mandatory masks. I would say of grades 9 and up in hallways as they were moving between classes. Now the change is that grades 4 and up, the masks need to be worn in classrooms, except if students are able to sit all facing in the same direction and be 2 meters apart. So essentially what it has done, we've also added in hallways for the younger grades. So we're basically masking of any grade as they're moving around in the school, and masking in classrooms for grades 4 and up.
And moving around in the school means from the bus to the classroom. So it is a significant shift in policy.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
My question is for the minister. Mr. Churchill, you had committed to $15 million in spending for inclusive education this year. How will that money specifically be spent this year, and how different is that from what you plan to do pre-COVID?
So obviously the situation is different in terms of the rollout of inclusive education hires. So what I can tell everyone is that those dollars are there. We are now at $45 million cumulatively that are baked into our education system to support inclusive education, hiring, staff, and support. So that money is still there. We have hired to date approximately 85 new support staff to our system. Most of those are new teaching assistants, and that's probably between a half and 2/3 are teaching assistants, and the rest is split between teaching specialists, so those would be teachers with specialties, and guidance counselors. So we have hired 85. There will be more hires, but we want to be strategic with how we hire these folks, because we went through a very different situation last year with students learning from home or trying to learn from home, and that is undoubtedly going to have an impact on some students more than others. And we're not going to have a full scope or idea of what the needs of those students are going to be until we give our teachers and our staff and our schools some time to assess the needs of those students. So we are stopping right now at the 85 hires until we have a better understanding of what the inclusive education needs are in our system, and obviously taking into consideration the situation last school year. You know, we had close to 30,000, we had 28,000 surveys that were conducted. 20% of respondents indicated that they didn't think their kids were going to be ready to get back to school. So we want to be strategic with the next round of hires, and there will be another round of hires for inclusive education. But we want to be strategic with how and who we're hiring, and it's going to be in response to our understanding of the needs of kids in our system.
Go ahead, John, with your follow-up.
Okay, I'm not sure you answered the second half of that question about how does it differ from what you had originally planned, but if you could deal with that in answering this the following question, which is what consultation did you have with the disability community in terms of coming up with this with this plan for kids who need extra help going forward this year?
Okay, so I guess the difference in terms of how we approach this is in previous years with the new inclusive education money is that we hired everybody, you know, heading into September, and we had a better idea what the needs were and where you know what staff we'd need to hire to kind of meet those needs. You know, from child and youth care practitioners to autism specialists, behavioral specialists, mental health clinicians. You know, the basket of staff that we've talked about previously. So obviously we are approaching it differently this year in that we've done a first round of hires, but we are going to wait to do further you know, clarification on where the needs of our kids are at. I hope that's answered the question, Jean. We continue to consult with stakeholders that represent students and families. We just recently met with Autism Nova Scotia, who are an incredible partner, and we're working with them to provide some. First of all, they've helped us out in a number of ways, helping train our teaching assistants and staff, and having professional development opportunities available for people. They've been part of you know, those folks that are looking and providing feedback on our implementation of inclusive education, and along with other stakeholders as well. I do not have a list of those folks in front of me. but actually, our deputy just met with the executive director fairly recently, and we're working on an FAQ for their community to make sure that people's questions are being answered. And of course, feedback that we get from those groups can very well help inform how the next round of hires plays out.
That's all the time we have for questions for today. We'll come back to the room for a few clarifying questions. Again, have to be clarifying questions. Go ahead, Andrew.
I just really like to ask one more question. Just
If it's a clarifying question, that's great, but we only have a few seconds left here.
I'd just like to know if there is going to be, if you're going to have weekly news conferences from this day forward.
I mean, right now the plan is to have, for education specific, right now the plan is to have these when needed, but there is a continuous proactive communication that will be going out to communities. So yeah, Dr. Strang and I, or whoever's appropriate, will be here on a needs basis. It's not necessarily going to be every week or something that we're not going to do that arbitrarily, but we will have fairly regular communication to parents and school communities, and so that happens in a few different ways. Of course, you get the public communication from the Department of Education when we're announcing policy changes or funding or anything from a system scope. Our regional centers of education continuously keep parents in the loop, and they will do that, and the communications locally will be more enhanced to keep people up to date on what's happening and to share information on the plan and how to prepare for September, and that information will continue to roll out in September. And of course, our principals and our teams in our schools are really good at keeping in touch with parents as well. So my voice and Dr. Strang's voice aren't always the most needed voice to communicate with parents. We've got a good system of communication that's in place right now, and parents will be and staff will be regularly updated on anything, particularly obviously if there's a case and if there's an increased risk level in any of our schools.
If it's a clarifying question, I'll take one. Go ahead, Alicia.
Just once again with the classroom and the masks, I mean, realistically, are there any classrooms where everyone can be 2 meters apart? Because just looking around right now, there's like less than 15 of us, and we're in about the size of a classroom.
Yes, I mean, it depends on the schools. I've traveled and seen some schools across the province, some small rural schools where that will be very easy to do. And I've seen schools here in HRM where the populations are higher, where that's going to be a challenge, which is why we're bringing in this additional safety measure of mandatory mask wearing for grades 4 and up.
It's also, we got to remember that if we move to the blended model, if there's increased activity, a key parameter of that blended model is creating the ability that every student that is in school is separated by 2 meters.
Yeah, thank you. Yeah, so that's part of that's baked into our plan right now. So if we have to, if we move to a blended learning model, and this can happen at the school level, at a regional level, at a family of schools level, or it can happen everywhere if deemed appropriate from public health. The older kids go home, and then we use that space to fully maximize spacing if that becomes required. So our ability to respond to an increased risk level is there, and it's baked into this plan.
Clarifying question. You said there were 2 schools or a couple of schools, few schools in the Halifax area that face the overcrowding issue. Can you name them?
I don't want to do that right now. I mean, I believe Clayton Park is one of them, and I don't have those schools named at the top of my mind. We've got a lot of schools, but I do know that I've heard from those school communities and their MLAs, and of course staff on those fronts. But generally speaking, I just want to be clear. Like we're doing really well with class caps. We've hired hundreds of new teachers to implement that into our system year over year. 98% of our classes are at or below, and in the cases where we're over, it's not by a large number. It's 1 to 3 kids on average. So I just want to push back on that image of all these that just an image that has been kind of that's out there that I don't think is supported by the facts.